This video is going to introduce kidney stones, including the symptoms and the difference between kidney stones and normal back pain, as well as its mechanism to all life science students. Kidney stone is a very common type of disease in human life, which shows the symptoms of fever, chills, pain when you urinate, and most likely to experience back pain due to the location of kidney is towards your back or underneath rib cage. And this kind of description often confuses doctors, in which it's hard to tell if the pain comes from the kidney or the back pain. However, we still have some methods to distinguish the disorder between normal pain and kidney disease. As kidney is caused by the kidney infection or stone in the tubes coming out of the kidney, the pain is felt on the area on either side of your spine, between the bottom of the rib cage and hips. And this usually occurs in one side, but can be both sides as well. In addition, the pain will be even more worse as the time goes on, meaning that it will not disappear automatically. Compared to the normal back pain, it is more common and only caused by a problem in muscles, bones, instead of the internal organs. And the pain is located anywhere on your back, but is very common in your lower back or one of your buttocks. This can be acute or chronic, but will get better if you have enough rest. So here arises a question that you may wonder why the infection of kidney can make your back feel uncomfortable, since we all understand that our immune system will cause a pain or an inflammation to show us there's a problem in our body for the purpose of resting and protecting ourselves. So feeling a pain in a specific organ or muscle means that something goes wrong with that certain muscle or organ. So here I'd like to introduce a new concept called the refer pain. Refer pain is a feeling of a pain on parts of a body, but that pain is actually caused by other parts. When injury begins, it's located at the spinal cord, and then pain receptors scatter throughout the body. These receptors transmit the signals as electrical impulse along the spinal cord and then upward to the brain. When we touch things and tissue damage, referring to the pain stimulus, this information is conveyed as action potentials involving two groups of nerve fibers. One group is the fiber carrying information about the noxious stimuli, known as the nociceptive nerve fibers, while the other nerve fibers is responsible for the touch and pressure, known as non-nociceptive nerve fibers. Since there are lots of nociceptive sensory fibers in one receptive field, and they all come from different parts of a body as they terminate into the same location, or in other words, the same second-order neurons. The convergence makes them all together, and starting location is unclear. When second-order neurons transport the signals into a higher center for perception, this information are provided ambiguously without knowing the definite places where this resource come from. Thus, this fuels the brain to detect which the pain is actually come from and the exactly initial point. In the case of kidney stones, as kidney is very closely located to our back, and they all belong to one receptive field, with many sensory neurons send them to the same location, it is hard to tell if it comes from kidney or back due to the mixture. Thus, your brain is confused about the real cause of pain feeling. As a result, when you have kidney stone, your back will feel the pain at the same time. And here's all the references I used. Thanks a lot.